Hi guys, this is Colin. Welcome to my tire talk. Today I'm going to be talking to you about subacromial impingement. So we're going to be going over what it is. We're going to go over the anatomy behind it. We'll go over what causes it. We'll go over who can get it. And then we'll talk about 3 things that you can do throughout the day that can help you combat this condition or even prevent it. So let's dive right in. So what is it? Subacromial impingement is, as its name is, subacromial. So the tip of your shoulder here is the acromion process. So underneath that and above the head of the humerus, which is your upper arm bone, there's a little space. It's called the subacromial space. It's about 1.5 centimeters deep, and there's a bunch of structures that run through it, which we'll go into in a minute. That when they get irritated, they can create less space. They can create bad mechanics of movement, and things get pinched. And there's typically overhead movements here that you feel the pinching. So overhead, you get to about level with your shoulder and it's, ooh, ow, that hurts. And you can't really go any higher. Out to the side, any sort of rotational movement is when you'll feel this pain. So what's the anatomy? So I talked about how this subacromial space here is about 1.5 centimeters deep, and it has 5 structures. So that doesn't seem like a lot of space for 5 structures to be going through. So you have your biceps tendon, you have your rotator cuff tendon, you have a subacromial bursa, which a bursa is just a little fluid-filled sac that's supposed to lubricate and cushion structures inside, help them move better. You have the joint capsule itself that surrounds the head of the humerus and attaches to the glenoid rim, which is part of the shoulder blade. And then you also have a ligament called the coracoacromial ligament, which runs from your acromion process to another point on the scapula called the coracoid process. And that kind of creates the roof of the subacromial space. So what causes the subacromial impingement? Well, if you have bad mechanics, such as repetitive overuse, throwing or swimming or tennis playing, and you're serving all constantly, or you are a dad who just had a kid and you're picking up your kid and you're throwing him up overhead and you're not really thinking about how your shoulders are moving, or you're picking up groceries constantly, and literally anybody can get this sort of condition. It's seen commonly in athletes who have repetitive overuse injuries, as that's what the nature of this injury is, but it's not exclusive to athletes. So there's the layperson who just had a kid, throwing their kid up in the air. There's spinal cord injury patients who have their main modes of mobility is a manual wheelchair, and so they're constantly using their shoulders for everything that they do. They can get this type of condition. So what can we do about it? So the main thing that I like to tell people for managing this condition is to watch your posture. So the biggest thing that you can do is make sure that when you are sitting anywhere, standing anywhere, that you are not slumped over forward with your shoulders rounded. You got a whole lot of extra curve in your thoracic spine here. All of this type of posture, and then your head's typically up because you're looking forward. That's something looking at the road or looking at your phone or looking at your computer. All of this posture here can create a whole lot of tightness here across the chest. And if you're sitting here, if you try this when you're watching, if you're trying to reach up overhead here, you can't really get all that far. It's because all this stuff on here is everything in here is pinched. I don't have this impingement, but it's hard for me to lift my head up or my hand up because the mechanics created by this posture don't allow me to take advantage of the full range of motion of my shoulder. But if you're up and your chest is open and your shoulder blades kind of sit down and back, it makes it a whole lot easier for you to reach up and do the things that you need to do. So playing sport, putting groceries away, or playing with your kid or anything like that. It makes it a whole lot easier if your posture is up, your chest is open, your shoulder blades are sitting in this nice neutral position on your back. So how do we do that? Every 15 minutes, every half an hour, if you're sitting, sit up, bring your shoulder blades back, down and back, hold this position for 2 minutes. Your head can be in a nice neutral position. It doesn't have to do anything funky. And while you're sitting here, act like you're holding a tray with your thumbs pointed outwards and your elbows tucked into your side, and rotate your thumbs out and point them towards the back, and squeeze your shoulder blades back together and hold this position for 3 seconds. And then bring it back. Don't let yourself fall into this position. Rather keep yourself in this nice neutral position. palms up like a tray, thumbs pointed out and back, holding it for 3 seconds, and bring it back. That's something that you can do 15 times, nice and easy, when you're sitting at your computer watching YouTube, or sitting at a meeting or something like that, or sitting on the couch watching TV. It's real easy to do, and just the biggest thing is that you sit up, you have your chest nice and open, your shoulder blades sitting down and back, and you should feel the difference between sitting like this, because it's a lot harder to breathe in this sort of position as well. It's a lot easier to breathe here, so it can help you breathing as well. So we also want to address the tightness in our shoulders that I kind of talked about here. Everything is getting tight here. So an easy way to do this is, if you have a wall or a door frame, is take your hand and put it flat on the wall. Line up your body kind of in line with the wall here, and then turn away from it, and you should feel a nice stretch going across your chest here. Hold this for 30 to 60 seconds. Do it 2 to 3 times. Try to do this 2 to 3 times throughout the day, and you should feel this nice stretch across your chest here. And you should do this on both sides, so that way you're not uneven. Even if you only have symptoms on one side, it's still good to do it on both sides. That in itself should help open up your chest. It should help kind of normalize the mechanics. It's like we talked about, if your chest is more open and your shoulder blades are sitting down and back, it's easier for you to reach all the way up to the top, right? So the key thing here being is watching your posture. If there's a rank and order of the things that we want to work on, it's making sure that your posture is correct and you're not sitting slumped over, and then working on the muscles that help with the mechanics of movement. So your external rotators here, your rotator cuff, and then getting the stretch in on the wall, kind of opening the chest up, opening everything up in the front to allow everything to move. Thanks for listening, guys, and I hope this was helpful.